Show some leadership. Friday is Juneteenth, commemorates the emancipation of slavery in the United States. It is a day that we should all reflect upon. It's a day that's especially relevant in this moment in history. I'm going to sign an executive order today, hence all my pens, recognizing Juneteenth as a holiday for state employees, and I'm going to propose legislation next year to make it an official state holiday. On the reopening, we're continuing to follow the data and the metrics. Our number of hospitalizations, lowest level since we started, amen, 1,400. Number of deaths, 17 deaths in the state of New York. 17. Lowest number since we started. I would feel, the only way I could feel better is if that number ever becomes 0. But 17, we remember in our thoughts and prayers the 17 lives lost. But this is great, great news compared to where we've been. Lowest level on the 3-day rolling average. That is the mountain. There it is. We always were wondering about the configuration of that mountain. What did it look like? How high was it going up? When would it crest? What was the plateau? How do we flatten the curve? How long would it take us to get down? And then, to add to the good news, we almost have too much good news, we did about 60,000 tests yesterday. Put that in context, 60,000 tests on one day. No state in the United States is doing that. 60,000 tests across the state. Number who tested positive, less than 1%. That is the lowest percentage of positive that we have had since we have started, period. That is one of the lowest levels in the United States of America. And we, once again, have demonstrated that we've gone from the worst infection rate in the country to the best infection rate in the country. Just think about that for a minute. Those are not words. Those are powerful facts. We had the worst infection rate. The rate of transmission was the highest. We now have the lowest rate of transmission. Just think about what this state accomplished, what the people of this state accomplished. And if I told you 108 days ago we were going to accomplish that, what would we have said? What would I have said? I would have said I didn't believe it. I would have said I didn't believe it was possible. But facts are facts. And you look at these facts, and I'm telling you today, the federal government is making a mistake. And it is making an historic mistake. And that is not a political comment. That is a fact-based, objective comment. That this federal government is making a mistake on the way it is handling this COVID crisis and how it is now advising states and the people of this nation. On the facts, it is a mistake. We had the political debate. How do we reopen? We should just reopen immediately. This is all overblown. It's fine. That was theory A, right? There was a partisan divide to it. More conservatives argued that. Government should just get out of the way, let the free market do it, right? That was the Wall Street Journal, New York Post, conservative theory, just open the doors. And then there was another theory. Let's reopen based on data. Let's not just reopen blindly as an expression of political ideology. We're dealing with a virus. The virus doesn't have a political ideology. No doctor ever said to me, oh, we did a COVID test, found out it was conservative, found out it was liberal. It's a virus. It moves as a matter of science. But there were two theories. We tested the two theories. We went into the laboratory, we tested the two theories, and now you have numbers. And numbers don't lie. You have 20 states where you have the COVID virus increasing as a matter of numbers. Fact. Look at the headlines. Facts. The COVID virus is increasing in 20 states across the country. The states without the smart reopening plans are going up. That is a fact. It's not a Democratic fact. It's not a Republican fact. There are no Democratic facts and Republican facts. They were just facts. There's Democratic opinion, Republican opinion, but there are no Democratic facts or Republican facts. That is a fact. Well, what's New York's interest in the rest of the nation? First of all, we're Americans, and we care about other Americans. Secondly, on a parochial level, if those states are going up, they could spread the virus to New York. They have a higher rate of infection than New York. What happens when those people get on planes and fly to New York? That's how we got here in the first place, right? People landing at our airports. So we do have a selfish interest. Same interest that so many states expressed when we were at the beginning of this, and they were worried about New Yorkers going to their states, right? We lived through that. Well, now it's the inverse. Now people are getting on planes, they're traveling. They could actually be bringing the virus to New York. Well, you hear from the federal government, the numbers are going up because we're doing more testing. That is just not true. As a matter of fact, as a matter of mathematics, as a matter of the data, that is just not a true statement. Forget the testing. Hospitalizations are going up. The number of people going into hospitals is going up. How do you explain that? Are they pretending to be sick? Are they not really sick? And you see the number of hospitalizations going up in those places where the percentage is going up in testing. First, their argument on testing doesn't make any sense because not only is testing going up, but the percentage of positive is going up. But even put that aside because it's complicated for people. People walking into the hospitals are going up, which by definition means more people are getting sick. Otherwise, more people don't go into hospitals. That's Arizona. That's Texas. And by the way, it tracks with the increase in the testing. But it is undeniable. But that more people are getting sick when more people are going into hospitals. New York, the number of people going into hospitals is going down. The percent testing positive is going down. These are facts. This is undeniable. When I say the federal government is making a mistake, these policies have real consequences. This is a moment in history where it's not going to be about the partisan divide when they write the books. They'll talk about the absurd politics. There's going to be real life and death consequences to this. They are now projecting, by the model that the White House uses, they have increased their projections to show almost 90,000 more people are going to die by August. 90,000. What these projection models do is they change their projection when the facts change. In other words, when they see numbers going up in states, they increase their projection. So they watch today's numbers, they see more hospitalizations, they then increase their projected deaths because they see more people going into the hospitals, so they increase their projected deaths. In April, they projected 60,000 deaths by August. May, they projected 134,000 deaths. Now they're projecting 149,000 deaths. Why? Because they're seeing the virus increase and they're seeing the hospitalizations go up. So this federal policy has increased the number of people who they project to die by almost 90,000. It's not a Democratic projection, it's not a Republican projection. It's the projection of the model funded by Gates, which is relied upon by the White House. 90,000 people. Think about that, 90,000 people. Well, that's the cost we have to pay to get the economy back up and running. Really? That hasn't helped the economy. When the virus goes up, the financial markets go down. When the virus goes up, consumer confidence goes down. When the virus spread goes up, people get more nervous and less confident about government and about the plan and about their future. Feel good. Invest in America. Oh, more people are dying. Oh, we're reopening, but it's actually increasing the spread of the virus. But feel good. Come out and shop. People aren't stupid. They're not. People are smart. In New York, we stay smart. Being smart, Westchester Rockland are to enter phase 3. Long Island is on track for Wednesday. New York City is on track for Monday. New York City will have been phase 1 for 14 days. You look at all the numbers are good. You look at the number of tests, the positive tests. You look at it from the point of reopening, the numbers are good. Hospitalizations, since reopening, the numbers are good. So New York is on track to enter phase 2 on Monday. The same metrics we use in New York City are the same metrics we've used in every region across the state. And they have all shown to be accurate and effective. We don't change the rules for New York City. We don't change the rules for Long Island. It's one set of rules for everyone. And they have worked everywhere in the state. They work when we are responsible in what we're doing. So New York City, do what every other region has done thus far. Employers have to be responsible, store owners have to be responsible, employees have to be responsible, local governments have to be responsible and do their job. They have to have their testing in place. Their testing has to be ramping up. Part of the phasing is allowing the local governments to increase their capacity to handle the additional burden. They like to leave that out. The role for local governments, the responsibility for local governments has been going up every time you hit a new phase. They have to have more sophisticated tracing, more sophisticated testing, more sophisticated compliance because the number of people are coming up. The phases are not just automatic. The phases are allowing the local governments to get their act together. And they have to, because this only works if the business owners are educated, if they're ready, if they have the plans in place, if the employees are ready, and if the local governments are ready. Today I'm going to be signing legislation to protect the rights of healthcare workers who speak out. Quote-unquote, whistleblowers should be protected. But New York has climbed the mountain. And it was the highest mountain in the state of New York. I'm going to declare the COVID mountain the highest mountain in the state of New York. It's not really a mountain, because it doesn't exist. But it's a mountain to me, and it's a mountain to many people. And it's a mountain that we had to climb, which was unlike any other climb, because it went straight up, and you couldn't see the top because the top was in the clouds. But the only strategy was every day to take the next step. Take the next step, take the next step, take the next step. It was hard. It was exhausting. It hurt. But you'll find the top, even if you can't see the top, through the clouds. Just keep climbing, you'll find the top. Almost blind faith. And we determined the top by flattening the curve. You flatten the curve, you create the plateau, you create the crest. We created the crest. But then we had to come down the other side. And that was a long journey. It was about 42 days up the mountain, about 66 days down the mountain when you look back. Who's counting? I was counting every day. We climbed the mountain, and we're on the other side. There are other mountains to climb. And remember that we didn't create this mountain. We didn't create this crisis. This crisis was created because the virus did not come from China. It did not come from China. Mistake. The virus came from Europe. The virus came from Italy. The virus came from France. The virus came from Spain. How did that happen? I never heard that. I know, because nobody ever said that. Nobody ever told us. The virus left China and went to Europe. That's what happened this past January. And then the virus came here from Europe. January, February, March. Federal government didn't do a European travel ban until when? March 16th. January, February, March. How many flights flew into JFK? And how many people came? 3 million. 3 million. JFK, Newark International. Did we screen those people? The federal government didn't screen those people because the virus was supposed to be in China, according to them. That's how the crisis was created in New York. That's why New York had the high infection rate. It had nothing to do with New Yorkers. It had nothing to do with a blue state. It had nothing to do with anything about New York. It's because we were misled. We were misinformed. And the virus was coming from Europe. That's what created the crisis. So we had nothing to do with the creation. And then we had the worst crisis in the nation. And then we were left on our own, by and large. But we managed it. It is a lesson that will go down in the history books, and a lot of lessons for us to learn on many levels. But we did it, and in many ways we should be invigorated because of it. That which doesn't kill you can make you stronger. We are stronger for it. I believe that. We're stronger as a community. And now we have other situations that we have to confront, other mountains to climb, but we have confidence after the last thing we've been through. And we will climb those other mountains, and we will do it together because we are New York tough and smart and united and disciplined and loving. And we are empowered to do that. And I look forward to doing that now that we are on the other side of this mountain. We'll climb new mountains together. And there are many new mountains to climb. For me, seeing those numbers back down, meaning we went up, we came down, and we're back where we should be, means we have to move on, stay vigilant, could come back. If you don't stay smart, it will come back. Could be a second wave. But we did what we had to do, my friends, and we did it together, and we did it every day. And now we're going to move on to other things. These daily briefings, while fun, take a lot of time. And I'm going to finish the daily briefings on Friday. And then we'll do briefings as necessary. And I'm sure they will often be necessary. But we're going to turn the page on the immediacy of this crisis. I hope people learn from what we accomplished here in New York. I hope people around the country look at New York and say, how did they do that? How did they go from the worst situation in terms of transmission to the best? How did they do that? I hope they look around and say, how can all these states be going up and New York is going down? How can that be? I thought New York had such a terrible problem. All that density, all that crowding. How's New York going down and our states are going up? What's the difference between what we're doing and what New York is doing? Isn't that peculiar? How can New York be going down and we're going up? That would be the logical question to ask. And there is a logical answer. And that answer can save lives. We have saved tens of thousands of lives in New York. And that is more important than any of this other stuff. I've signed the executive order. Questions?
Governor, in terms of saving lives, there have been roughly now about 6,200 confirmed and presumed deaths in nursing homes. And talking to medical experts, specifically those that study nursing homes, they've said that perhaps that March 25th directive that we've all talked about at length potentially contributed to more deaths than might have been seen in New York had that directive not been implemented. So wondering, who advised, and this is also a question for you, Commissioner, who advised both you, Governor, and you, Commissioner, regarding that March 25th directive, and do you regret putting that into play? I know now it's been partially walked back. Do you regret it?
Let's do this one more time. I understand the politics on the issue. I understand what the Republicans say on the issue. It's not a coincidence that this is primarily an argument put forth by Republicans, right? That is a factual statement. Factually, it is. You look at the congressional members that put it forward, they are Republican congressional members. You look at the columnists who put it forward, they are primarily Republican conservative columnists. That is a fact. And here's the fact to them. We followed federal CDC guidance. If they want to start with an analysis of in retrospect, start with the first fact why did the federal government give that guidance to states? That's the only relevant question if you want to go down that road.
Well, Governor, hold on, as
Go
a
ahead.
follow-up, Governor, but then why didn't you listen to either the health department or other state medical professionals who could have advised? You just spent the past half hour talking about how the federal government was mistaken. Why didn't you guys, after 3
If you
months
ask,
of this?
we did, and if you ask
Who? Who did you
public
talk to?
health officials, so first you have the federal government that gave that guidance, and then if you ask public health officials all across the board, when a person is no longer a senior citizen, no longer needs a hospital, is it intelligent and in that patient's interest to leave them in a hospital bed for 2 weeks at a period of time where they're probably no longer contagious, they're just not yet testing negative? They will say to you, it is highly risky to leave that person in a hospital bed for 2 weeks while COVID is raging and they are susceptible, because the likelihood of negative consequences to them is much, much higher if they stay in a hospital bed. And they will say a nursing home is a better environment if the nursing home can provide adequate, safe care where they care for that COVID person in a way that protects the other people in the facility, even though that senior citizen may not be contagious at that point. And the condition of the nursing home accepting that person was that the nursing home said, we can take that person and treat that person and give that person the treatment they need, and we can do it in a way that protects the other people in our facility. They will all say that was the best path for that senior citizen. They will all say, don't leave a person in a hospital for 2 weeks. There are infections. You can get sick being in the hospital, believe it or not. Sepsis, et cetera. So get that person out of the hospital as soon as you can. The person is probably in a stage of the disease where the person is not contagious. They just haven't tested below the antibody level to be negative. If the nursing home says we can take that person and protect the others. And that was the system in every case. In every case. New York State is 35th in the nation. 35th in the nation in terms of percentage of nursing home deaths. 35th in the nation. So Mr. McManuses of the world, Mr. Goodwins of the world, find a different argument. Or start with the fact, if there is any facts left, it was guidance from Mr. Trump. Go ahead, sir.
Governor, but
Thank
did you
you.
talk to anyone from the Medical Society of New York?
Well, is that
Did you talk to the
your,
nursing
is that
homes?
your medical opinion, doctor, or do you want to add anything?
I think the governor has crystallized this. I would add one point is perhaps you should look at the Harvard expert who mentioned that that this is from asymptomatic people who came into the nursing home workers. But I think the governor has crystallized that answer.
Actually, so he also has a problem, as do several other experts, with how the state health department has changed data. So on that, how come you guys stopped recording in the daily coronavirus death counts regarding nursing homes the people that were from nursing homes who died in hospitals? That disappeared from the tally. Why did you guys change that?
That data is in the hospitalization data. It's there. The data is.
It's not in the nursing home breakdown.
We have. You can go online. You can see all the data that we have there.
You guys also stopped including the top line number, so now I have to tell you.
Yeah, I know. Well, you can either talk to Harvard, or you can talk to public health officials like
The other point that I would just like
McManus
to
and
make
Goodwin.
is when you actually look at the nursing home by nursing home breakdown, you see no correlation between the readmissions and the deaths, which is something that I think that the reporters, I know the AP has looked at the readmissions, and there are a number of hospitals where there have been no readmissions, where there are up to 50 deaths, and then there are some hospitals there are 5 readmissions and there are 10 deaths. There's very little correlation to no correlation between when you actually look at the individualized hospital data. Furthermore, the directive that came out on March 25th was not an executive order. It was done by the DOH. DOH did it in consultation with the CDC and CMS, as did a dozen other states. The thing that you referenced at the top, or that the governor referenced from the Republicans in Congress, I find it interesting that it's a handful of Republicans in Congress directed only at states with Democratic governors. So I think it's important that we look at the actual facts and the actual data, and we get to the bottom of this, because as the governor said, it's likely that we see another wave. So what are we learning? How do we deal with it? And how do we go forward in a productive way? And part of that has to be relying on international and national experts, and that means the federal government has to know what it's talking about.
Governor Blasio wants to expedite the release of body cam footage, speed up the disciplinary process, and release disciplinary records of police officers online. Are you going to require the same for state troopers and other police departments across the state?
I don't think we should be doing this piecemeal. You have all sorts of piecemeal proposals that are out there. I'm not commenting on Mayor de Blasio. I don't know any of these proposals that you mentioned. But all across the country. People are doing piecemeal suggestions, which are nice, but are not especially helpful. No tear gas, no rubber bullets, cut the budget 100,000, cut the budget $1 billion, reduce staff 20%, demilitarize police. Okay. Let's do it the most intelligent, effective way. Start with a blank piece of paper and design your police force. This is 2020. We haven't redesigned the police force fundamentally for decades. Let's get all the stakeholders in the room and let's design it. What is the function of the police department? First question, what do we want it to do? Second question, what do we want it not to do? How many people will it require to do that? What are the skills of the people required to do those functions? How much will it cost to put together that department? What lessons learned from these past episodes do we want to take to heart? What's our use of force policy? When we say demilitarize the police, what do we mean? What equipment do we not want them to use? How do we want them to handle protests? You've seen terrible footage. How do we want police to handle protests? How do we want them supervised? What's our disciplinary process? Do we have body cameras? How often do we publish the body camera footage? How do we handle complaints? Complaints come in. Who should review them? When should they go online? What should the disposition be? That's how to use the moment. To make one little change in the structure, my point is different. You have to start with the foundation and build up. But the foundation is the problem. Because you know what the foundation is? You know what the foundation of the police department rests on? 2 pillars. Respect and trust. Those are the 2 pillars. Everything rests on those 2 pillars. And you know the problem? Those 2 pillars are cracked. So start with the respect pillar and the trust pillar on the foundation, then you build up what color uniforms, how many cars, but start with the pillars.
Specifically, no, Governor,
Sir.
I have a specific question about, are you going to be requiring the state troopers to be releasing disciplinary records online to comply with the new 50A law?
We're going to go through the same, yes, we're going to go through the same process. 50A applies to the state police.
When you look at the existing holidays that the state celebrates, like MLK Day, which is also about civil rights, why did it take so long for Juneteenth to be recognized, especially when you look at emancipation being the thing that spawned the Negro National Anthem, Lift Every Voice and Sing, for example? That indicates that it's a pretty significant event. And related to that, the state has an MLK Day celebration every year. Would you also consider a Juneteenth celebration?
I would. Why? Look, live and learn, right? Society progresses, we change, we evolve, hopefully we change for the better. During some periods in history we do, some periods in history we don't, some periods in history we go backwards. But I think this is a period where we could see monumental change. And I want to be a force for change. And I want to help synergize this moment, whether it's reform on the police department, whether it's an expanded racial understanding and sensitivity and progress. And if Juneteenth is part of that, and a recognition of what happened, and an understanding of what happened, and an acknowledgement of that, great.
I don't mean to play the race card, so to speak, but I can tell you that the functional equivalent of July 4th for the country at large is what Juneteenth is to the Black community as far as emancipation goes, because obviously freedom is the topic of discussion. So would you say that up to this point, the general public and elected officials as a whole haven't recognized the importance of that?
I don't think it has been recognized for the importance that it denotes, and that's why I'm going to propose legislation to make it an official holiday next year. And that's why this year I'm doing what I can. What I can do is by executive order, make it a state holiday for employees, and that's what I'm doing. So the most I can do by executive order, and then next year I'd like to pass a law to that effect, because I acknowledge exactly what you're saying. And this would be a first step for the state. It may be a first step nationwide. I don't know any other state that has recognized Juneteenth this way. I'm not fully informed, I'd have to go back and look, but off the top of my head, I don't know that any state has done this. So I'd love to see New York as the first.
The Supreme Court's supposed to make a decision on DACA here very shortly. Has the state thought of ways to possibly extend that program here in New York? Is that possible?
We have to see what the court says, and if there's any crack or light for state action, then we will take it. Let's take one more question.
Teachers and districts are looking for clarifications that they can start preparing over this summer. Will schools open for fall of this year?
Yeah, we don't know for sure yet. We have to see where the virus is. We are in very good shape on controlling the virus in New York right now. There are question marks. Nationwide, globally, there are question marks. Is there a second wave? Is there a resurgence? There are national question marks. These other states are going up. Do people in Florida get on a plane and come here and we see an increase? Question mark, did the protests increase the spread of the virus? Or hopefully, did they happen at a time where the infection rate was so low already, about 1%, that even though they violated social distancing, et cetera, it didn't have an effect? Question mark, will local governments do their job? Are they doing the tracing and the testing and compliance? Question mark. So to say today, as we sit here in June, what is going to happen in September? Nobody can tell you. Nobody can answer that question. And think where we are today to September, and think of the period in time backwards. All this transpired, that whole mountain, that's 100 days. That's all that is 100 days. 3 months, the whole world changed. So September, let's get some more information and facts, and then we'll decide.
Paul, you've talked about the need for that sort of standard nationally, or, because it's a big decision.
We
for
answered
local.
those questions, right?
No, you didn't. You closed down the center of Camp Sleepaway.
We did.
What do you want parents to do?
See you next time.
In 60 years, we went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You were donating plasma to get by.
It's literally a slave wage.
I don't remember growing up like this. My mom didn't have to go to food banks. It's pretty sad. How do we put this in perspective about how worried we should be?
We're going to share the newest numbers and critical information on the outbreak.
Vladimir Duthier is tracking the plight of the restaurant business. Vlad?
You've been talking to doctors. What are they saying to you about their experiences?
Doctors and scientists in a race against time to cure coronavirus. Every evening we'll show how close they are, racing to a cure on the CBS Evening News with Norah O'Donnell.
These are hard, tiring, taxing jobs, even before coronavirus came.
This is my Clorox wipes, my Lysol. I have no idea what I'm walking into. I don't know if the customers are carriers.
I feel privileged to be out here when so many people are out of work.
Did you ever think that you would find yourselves at the front line?
We have the opportunity to bring something valuable to the community, and that feels good.
We have to be willing to change policy on a permanent basis to recognize and honor these workers.
It doesn't seem like it's worth the risk that you endure every day.
I have to do what I can to take care of myself and my family.
If you had the choice, would you stay home?
Maybe, yeah.
Oh my God, the truck is sinking.
Devastating flooding has reached catastrophic levels.
Rising sea levels are threatening America's coasts.
You would have to take that house and put it on stilts 10 feet tall. If the street is filled with salt water, what difference does it make how high you make your house?
The concentration of the highest rental rates is exactly where the elevation is highest.
This was the evidence to prove that climate gentrification was real.
Pay $1,800 in 5 days or you have to leave. Were you scared?
Yes.
Every single person who stood up and said, I am not paying this rent increase, received an eviction.
Haitians built this place and you're getting kicked out.
Yes.
Well, North Korea is threatening to send troops to demilitarized zones along the border with South Korea as tensions rise between the two countries. And this is coming, of course, just a day after Pyongyang blew up a liaison office, often used for official meetings between both of those countries. Remy Inocencio has the latest.
That de facto embassy was officially known as the Inter-Korean Liaison Office, was only established back in 2018 and stood just north of that heavily militarized border across from South Korea in a city known as Kaesong. But now it just doesn't exist. North Korean state media released these images of the demolition in a now you see it standing, now you don't kind of event. And that's not the end of it. Pyongyang has threatened to do even more, to redeploy its military troops to border areas that were demilitarized earlier. That includes rebuilding guard posts and restarting military exercises near the border. All of this would reverse agreements from 2018 aimed at lowering tensions. Now, it's interesting and important to note that Kim Yo-jong, that's Kim Jong-un's younger sister, has been taking the lead on this. After her brother disappeared for 3 weeks earlier this year, there were rumblings that she might be his successor. Ultimately, experts see this as Pyongyang's attempt to try to extract concessions from Seoul as well as Washington. Its economy has already been slammed by sanctions and possibly even more so by the coronavirus pandemic. Ramy Inocencio, CBS News, Tokyo.
Tensions are running high between China and India after a deadly clash at the border between the two countries on Monday. India says at least 20 of its soldiers were killed. Arshad Zagar brings us the latest from the region.
More than 24 hours after this incident, we still exactly don't know what happened during the deadly clash on India-China border. What we do know is that at least 20 Indian soldiers were killed on Monday night. That's according to the Indian military, who also claimed that Chinese troops suffered casualties. Allegedly, no shots were fired, and the deaths were a result of hand-to-hand combat. Indian Prime Minister has spoken very strongly, saying the deaths of Indian soldiers will not go in vain. He said India wants peace with China, but is capable of giving a befitting reply if provoked. The Prime Minister did hold meetings with his Defense Minister and the Army Chief late last night. Earlier in the day, China said it does not wish to see more clashes on the border. The two Asian giants have had a largely peaceful relationship so far, except for a brief war in 1962. And not a single bullet has been fired by soldiers of the two countries at the disputed and non-demarcated 2,100-mile border in the last 45 years. But while the two countries have shown eagerness to de-escalate, this incident has surely caused an unprecedented bitterness between them. If India would be preparing some kind of a response, it's also likely that it will be a non-military response. Arshad Zagar, CBS News, New Delhi.
In China, Beijing is taking several steps to curb an ongoing resurgence of the coronavirus. Those steps include canceling flights, shutting down schools, and blocking off some neighborhoods. Health officials reported 31 new confirmed infections yesterday, bringing the total since Thursday up to 137. It is the worst resurgence of the disease in Beijing since early February. The outbreak has been traced to a wholesale food center in the southwest of the city.
Brazil says it has its coronavirus outbreak under control, despite setting a national record yesterday for new infections. The country's health minister says nearly 35,000 new coronavirus cases were confirmed in just 24 hours, and the death toll from COVID-19 is more than 45,000. Brazil now trails only the United States in the number of confirmed coronavirus cases and fatalities.
We're going to take a quick break. You are streaming CBSN.
In 60 years, we went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You were donating plasma to get by.
It's literally a slave wage.
I don't remember growing up like this. My mom didn't have to go to food banks. It's pretty sad.
How do we put this in perspective about how worried we should be?
We're going to share the newest numbers and critical information on the outbreak.
Vladimir Duthier is tracking the plight of the restaurant business. Vlad?
You've been talking to doctors. What are they saying to you about their experiences?
Doctors and scientists in a race against time to cure coronavirus. Every evening we'll show how close they are, racing to a cure on the CBS Evening News with Norah O'Donnell.
These are hard, tiring, taxing jobs, even before coronavirus came.
This is my Clorox wipes, my Lysol. I have no idea what I'm walking into. I don't know if the customers are carriers.
I feel privileged to be out here when so many people are out of work.
Did you ever think that you would find yourselves at the front line?
We have the opportunity to bring something valuable to the community, and that feels good.
We have to be willing to change policy on a permanent basis to recognize and honor these workers.
It doesn't seem like it's worth the risk that you endure every day.
I have to do what I can to take care of myself and my family.
If you had the choice, would you stay home?
Maybe, yeah.
Oh my God, the truck is sinking.
Devastating flooding has reached catastrophic levels.
Rising sea levels are threatening America's coasts.
You would have to take that house and put it on stilts 10 feet tall. If the street is filled with salt water, what difference does it make how high you make your house?
The concentration of the highest rental rates is exactly where the elevation is highest.
This was the evidence to prove that climate gentrification was real.
Pay $1,800 in 5 days or you have to leave. Were you scared?
Yes.
Every single person who stood up and said, I am not paying this rent increase, received an eviction.
Patients built this place and you're getting kicked out.
Yes.
Senate Republicans have unveiled a sweeping bill focused on police reform. Majority Leader Mitch McConnell and South Carolina Senator Tim Scott just introduced the legislation on Capitol Hill. It focuses on use of force, no-knock warrants, and chokehold bans, but there's growing questions over whether it goes far enough, especially as House Democrats gear up to vote on their own police bill.
You support restoring the confidence that communities of color have in institutions of authority. If you support America, that means you know that the overwhelming number of officers in this nation want to do their job, go home to their family. It is not a binary choice. This legislation encompasses that spirit. It speaks to the fact that we believe that the overwhelming number of officers in this nation are good people, working hard, trying to keep order in the communities. Communities of color and people like myself, I've told my story several times, stopped 7 times in 1 year. That has been said a lot, but I was stopped this year driving while black when I got a warning ticket for failing to use my turn signal earlier in my lane change. And so this issue continues, and that's why it's so important for us to say that we hear you. We're listening to your concerns.
So let us bring in Nancy Cordes standing by on Capitol Hill for us. Nancy, we have the Democrats' bill that's being floated. We have the Republicans' bill that's being floated. There's a lot of overlap, but it seems like neither party can actually agree on what the root cause is.
Well, I think they see the problem differently, or at least they feel that it's important to talk about the problem differently. Republican leaders, we have asked them a number of times, have been very careful not to say that they believe that there is systemic racism in policing. I think partially it may be something that they believe. It may also be something that they believe would not be popular with their base to say, but they have had the opportunity multiple times to weigh in, and they have, both at press conferences like this one and in hearings, rejected that. They have really moved much more towards the model of arguing that there are a few bad apples, but that the overwhelming number of police officers want to do the right thing. So it's just a fundamental difference in rhetoric between the way that Democrats and Republicans talk about this. One thing that both sides do talk about in much the same way now, which is a big shift, is they are both very open about the fact that African-American men in particular have a very different experience with the police than white men and frankly, all other people. That is something that is universally recognized, discussed openly, and that's part of the reason that you now see both Democrats and Republicans saying that they are genuinely committed to reform, even if the way they go about that reform is very different.
So we heard Senator Tim Scott say, look, you know, between us and what the Democrats are floating as a bill, there's an awful lot of overlap. I know you can't go through everything because these bills are really, really sort of extensive, but can you give us sort of the some generalities? What's similar about what the Democrats want, and what are some of the key differences?
I think the simplest way to think about the differences between these two bills, Anne-Marie, is that they have a lot of the same goals, but they go about achieving those goals in different ways. So in the Democratic bill, they try to change policy at the federal level. Chokeholds, banned. No-knock warrants, banned. A national registry for police misconduct, created. These are policies that they set out at the federal level and that they expect local and state police departments, law enforcement agencies to follow. The Republican bill tries to achieve some of those goals using financial incentives. So it says to local police departments, if you don't ban chokeholds, you're going to lose some federal dollars. If you don't report your use of no-knock warrants to the FBI, you might lose some of that federal money. Same with body cameras if you don't use those. And so Republicans, just like they do in many pieces of legislation, they've kind of rejected this notion that the federal government should be point blank telling police departments what to do. It should be incentivizing them to do the right thing. Beyond that, there are some really big differences in the goals of these two pieces of legislation, most notably the fact that the Democratic bill would roll back qualified immunity protections. These are legal protections so that police officers can't be sued for wrongdoing. Democrats say they've got too much protection. Republicans, many of them, not all, say that if you roll back that protection, that all kinds of frivolous lawsuits will pop up. Police officers will rack up thousands of dollars in legal fees. They won't even want to enter the profession. And so that is missing from the Tim Scott bill. And you heard him talk about the fact that he's a little frustrated that there is no middle ground that is apparent to him at this time that can get enough votes to pass. And so that problem really isn't tackled at all in his bill.
The other thing that is interesting to me, Nancy, is this dancing around the language that the President of the United States used yesterday in attacking the presumptive nominee for the Democratic nomination, Joe Biden, in saying that in 8 years, President Obama and Vice President Biden did nothing to address this pattern of police brutality in America, which is simply not true. In fact, there were a number of things that the Obama and the Biden administration did, including opening up some 25 investigations, federal investigations into police forces across the country. And another key point that doesn't seem to be addressed, at least I don't think it is, Nancy, you can correct me if I'm wrong, in this bill, which is the limit that President Obama placed on the 1033 program, which was a program that allowed police forces across the country to purchase military equipment. President Trump rolled that back because of a promise that he made in 2016 to police unions. I don't know if there's anything that addresses that in this bill.
This bill does put some limitations on the transfer of military equipment to local police departments. It doesn't go as far as the Democratic bill, but you're absolutely right, Vlad, that this is such a tricky issue for Republicans because, the president is such a wild card, and he said so many things that run counter to the truth on this issue, but also counter to some of their goals, and yet they don't want to alienate him because if they are able to pass legislation, they need him to sign it. So they need him to be on their side. So they have kind of turned the other cheek, if you will, when he says things that are racially insensitive, when he says things about policing that aren't true, because they feel that they need him on their side at the end of the day.
Nancy Cordes, thank you so much.
Right.
Appreciate it.
You're welcome.
So the Justice Department is suing President Trump's former National Security Advisor, John Bolton, over the release of his upcoming book. It is published, and it will be released next week. It's published by Simon & Schuster, which, as a reminder, is a division of Viacom CBS. So we want to bring in Paula Reed now to talk about the latest coming out of the White House. Paula, what's the Justice Department's main complaint? Because as I understand it, these books, typically don't get published unless they've already gotten a once-over from the White House or the Justice Department.
Well, we know, Anne-Marie, there has been a review process, but the question at issue is whether that review process had concluded before these books were shipped to the warehouse. And yesterday, the Justice Department filed this suit asking a judge to block this book from being published. It's expected to be published next week, and also possibly try to put all of the proceeds from this book in a trust. Now, the Justice Department argues that Ambassador Bolton participated in the review process, looking for any classified information that he may have included, but then they claim that he became, quote, dissatisfied at the pace of the review and, quote, decided to take matters into his own hands. So what they're asking the court to force is for him to hold off on publishing this book and to continue the review process. So we'll see what the judge says here, but it's not just the book. I mean, the book is sitting in warehouses. There are people who we believe who have copies. He's already sat for media interviews, and it's not clear that the court would have any authority to keep a network from airing that interview where he discusses the contents of this book.
Yeah, that was going to be my question to you, Paula. I mean, the book's already out there. Could a judge potentially, even if a judge were able to stop the book from being released, it's already in the hands of distributors. Is there anything legally that can be done at this point?
That's right. The book is in the warehouses. It appears that if they believe that horse has left the barn, instead they're going to try to target the profits of this book. They're asking the court to create a, quote, constructive trust on any profits that are obtained. But it does appear, though, that they may need to tie that claim to proof that he actually mishandled classified information. And so far, he and his attorneys insist that he went through the review process, that he removed any, quote, national security concerns from it, and that there shouldn't be an issue. Now, his lawyer said last night that they're reviewing it. They'll respond in due course. But in my previous conversations with his attorney, Chuck Cooper, Cooper told me that, yeah, they went through the process. They believe they made necessary accommodations. But then we know the Justice Department actually learned the book was going to be published. It was supposed to be published a while back, but they learned it was going to be published next week through media reports. And then his lawyer says they started getting additional correspondence from the White House suggesting that the current manuscripts still contain classified information. But his publisher right now is standing by him, saying they protect his First Amendment right to publish this. They're saying that this is just a, quote, long-running series of efforts by the administration to quash an unflattering book. So it doesn't appear that the publisher is going to hand over those books too readily. It'll be really interesting to see the outcome of this case. I don't think it's going to be, it's unlikely that the government's going to get everything they want, but they're going to have to provide some proof that this is more than just a thinly veiled threat. And if nothing else, taking this out of the legal arena, this is getting a lot of attention for this book.
All right, so let's flip back to the topic that started this whole show, police reform. The president signed an executive order yesterday. Of course, some people are applauding him for the executive order. Others are critical of it, saying it doesn't go far enough. The acting Secretary of Homeland Security, Chad Wolf, was actually on CBS this morning, and he addressed the executive order. Let's play a little of that.
I think the president's shown in his demonstrated leadership on this initiative. It's a tough issue, but it's one that, again, through the executive order, there's a number of things in there that pushes this issue forward. And as you indicated at the top of your segment, the president said yesterday he's willing to work with Congress, Tim Scott and others in the Senate and the House to continue these reforms. If Congress wants to put additional measures in there, the president and the administration is certainly open to that.
And we heard from Tim Scott and the other senators just less than an hour ago, and it was clear that they were definitely sort of careful about their wording when they talked about the president. They did not want to be critical of some of his law and order messaging that we've been hearing up until this point. What would the president working with Congress look like?
Well, the president signaled yesterday that he is now willing to work with Congress. We have to remember that this executive order is not legally binding. The government has not tied any federal funding to cooperation with this order. They're merely encouraging police departments to adopt better accountability standards. So if anything is truly going to change in accountability, it needs to go through Congress. It needs to be an actual law and a law that the president will sign. And you heard in that press conference, it did not appear that they have the president's endorsement for their proposal, though they were hoping that they will get it. But to the secretary's comments there saying that the president's executive order does move this issue forward, the question is what issue? Yesterday's executive order made no mention of racial bias. It made no attempt to address that issue or how to fix it. We've pressed other senior administration officials who work directly on this executive order. No one has been able to articulate how they plan to address that specific issue, which has sent thousands, tens of thousands, hundreds of thousands of Americans to the streets over the past 3 weeks in an uproar over the death of George Floyd and a demand to address racial disparity in law enforcement. So far, that issue has not been addressed by the president or by this executive order.
The other thing, Paula, before we let you go, and something you perhaps heard us talking to Nancy Cordes about, but I'm curious for the White House perspective. Again, yesterday, the President of the United States said that President Obama and Vice President Biden did nothing for police reform during the 8 years that they were in office. That's simply not true. And I know you fact-checked this as well. But just again, I pointed out the 1033 order that the President rescinded to allow police departments to receive military equipment, something that the Trump administration rolled back. The other thing that I pointed out, now tap your lawyerly skills here, which is these 25 investigations that the Obama administration opened into police departments to see whether they were engaged in a pattern or practice of misconduct. That's 25 investigations. In comparison, the DOJ under President Trump has so far only had one investigation, and they've signed only 2 agreements that were based on investigations that started when President Obama was in office. So again, the president, seemingly reaching out to Americans and saying that he wants to see some kind of reform while attacking the previous administration and saying that they didn't do anything, which is clearly false.
Absolutely. It's completely a lie to say that the Obama administration did not try to pursue police reform. And not only did the president say that, but then his press secretary went on Fox News a short time later and doubled down on that. So it wasn't just a slip of the tongue. I covered the Obama Justice Department as well as the Trump Justice Department. And you are right. The Obama Justice Department opened more than 24 federal investigations looking at various law enforcement agencies across this country, trying to identify any civil rights abuses, patterns or practices of racially discriminating police practices. They did that in Ferguson. They did that in Baltimore. They did that in Chicago. They also used a sort of community-based resources, trying to build trust through their COPS office. As you noted, they also tried to reduce the sale of some military equipment to police officers, and they did a lot of funding for body cams for officers. Much of that was rolled back by Attorney General Jeff Sessions and the Trump Justice Department. Now, what's interesting is it does look like they may be trying to bring some of those reforms back, specifically funding for body cameras, but you're absolutely right. The previous 3 presidents, both parties, have opened nearly 70 federal investigations into police departments. The Trump administration has opened just 1. That is into a discrete issue in Springfield, Massachusetts, into that police department's narcotics unit. So it's clear, it appears that the Justice Department under this administration, federal oversight of racially biased policing has not been a priority. Now, our Margaret Brennan did ask the Attorney General about this, and he dismissed it. He said that he's not interested in gestures and that he wants to try to build trust between the community and police. But again, those pattern and practice investigations are an enormous tool. While publicly some police unions may dismiss them, I talked to many officers across this country who had been through it or were going through it, and many of them would tell me actually they appreciated when the federal government got involved because often they could get resources, be it computers, be it training, all kinds of things that they couldn't get from their local government. It's not that they wanted to not follow the best standards, it's that they didn't have the resources, and sometimes that federal oversight is exactly what they needed to get what they needed to do their job safely.
It's such a great point that you make, Paula. And, I remember when I was covering the protests in Ferguson, when Attorney General Eric Holder came to Ferguson what that meant to the people who were taking to the streets every night to see the highest-ranking law enforcement officer in the country appearing there in Ferguson to talk to the police, to talk to the mayor, to talk to the governor. It was a real powerful moment. I'm still waiting, I'm guessing, for Bill Barr to appear in Minneapolis or in Atlanta or in any other places that are seeing
well, Vlad, I mean, you make an important point, Vlad. I mean, I think what's interesting is both administrations sort of missed the opportunity to address both sides of this equation. Because I remember Holder was criticized often for not being more supportive of law enforcement or for not visiting law enforcement officers, but visiting victims. And some people told me that they believe that he was sort of tipping his cards in terms of his feelings about law enforcement. Now we have Bill Barr. We had Attorney General Jeff Sessions. These are folks who skewed it completely the other way, almost reactionary, really only supporting law enforcement and not being really willing to address this issue of racial bias. And as you guys talked about with Nancy in the earlier segment, it does appear there is a middle ground that no one is really willing to stake, which is what it will ultimately take to bring these two sides together for a conversation to implement reforms to make policing more safe, not only for communities, but also for police officers.
Such a great point. Love talking to you, Paula, because I know that you were a lawyer in a former life, and it just fits into the analysis and the reporting that we're doing around this very important issue. Paula Reed at the White House for us. Paula, we appreciate it.
A judge in Tulsa, Oklahoma, where the president plans a campaign rally this weekend, has denied an effort by local residents to block the rally amid concerns about the spread of COVID-19. So Kristen Weaver from our Tulsa affiliate KOTV has more.
The crowd of Trump supporters camping outside the BOK Center continues to grow as they hope to be the first inside President Trump's rally this weekend.
It's hot during the day, but in the evening when everything cools down, it's great.
Tulsa attorneys say they filed the lawsuit trying to make those people safe. They say the 19,000-person indoor event will be a super spreader of COVID-19.
The risk is just absolutely unacceptable.
So that's why they requested an emergency court hearing asking the BOK Center's management company to require a mask and social distancing for all people attending the rally.
That this is the highest risk event for transmission of the virus. This is a super spreader event in downtown Tulsa. And those of us who work and live within blocks, miles of this building are scared.
But a Tulsa County District Court denied the request. Tiffany Nixon, a Trump supporter eagerly waiting for Saturday, says she, for one, won't be wearing a mask.
They can do what they want, but I mean, really at the end of the day, if you're sick, you don't need to be at the Trump rally.
The BOK Center will be giving out masks and hand sanitizer and checking temperatures before people can go inside. And when people sign up for tickets, they have to sign a waiver saying they won't sue the campaign if they contract COVID-19.
In Louisville, attorneys for Breonna Taylor's family are accusing the city's mayor and the Metro Police of unlawfully withholding information. According to the family's legal team, the LMPD has yet to release Taylor's autopsy, the personal reports related to the officers involved, and the mayor's communication involving the case, despite being subpoenaed. Attorneys also say they've been denied access to open records. The attorneys claim the documents are being held under the direct orders of Mayor Greg Fisher, who is yet to respond.
In California, the lawyers for Robert Fuller's family say that they will seek an independent investigation and autopsy to determine the cause of his death. The 24-year-old black man was found hanging from a tree last week in Palmdale. Authorities initially said his death appeared to be a suicide, but an official cause of death has not been released. The family is asking for the independent autopsy to be paid for by the city of Palmdale. The Los Angeles County Sheriff has vowed to conduct a thorough investigation and says the FBI's Civil Rights Division will monitor it.
The biggest names in politics.
Whoa, that's news. Did the CDC let the American people down?
Face the questions you want answered.
Do you need to level with the American people the decision? When was it made? Who made it? What does that mean for the risk of reinfection?
Good point, Margaret.
Margaret, that's a great question.
Face the Nation with Margaret Brennan on CBS.
Today, we went to the National Mall and to speak with historian Lonnie Bunch. What do you think history teaches us about this moment we're in?
This is a time for us not to rest.
State police are here. You can see them behind me holding down this block. Behind them are the firefighters. They are dousing the flames.
Do you think racism is deeply rooted in Minnesota?
It's deeply rooted in America.
It has been a day of raw emotion here in Minneapolis as this city and the country mourned a man whose death has inspired a movement. We are witnessing it right now.
It is my fervent prayer that we all will commit to actively engage in working on a heart change and model the most powerful four-letter word in any language, and that is love.
What do you hope comes from this?
To be honest, this is what's coming from it. This is what's coming. The change is here.
If George Floyd's death is a tipping point, this is the center of it.
The CBS Evening News with Norah O'Donnell from Washington, D.C. Doctors and scientists in a race against time to cure coronavirus. Every evening we'll show how close they are, racing to a cure on the CBS Evening News with Norah O'Donnell.
Presented by GoDaddy.
U.S. Census Bureau data shows about a third of Americans are experiencing symptoms of anxiety or depression amid the COVID-19 pandemic. A new membership-based therapy startup for women called Real is helping address those mental health needs. But first, they had to pivot when their own launch plans were set back by COVID-19.
Days into New York's stay-at-home order, Real founder Ariella Safira was confronted with an unprecedented challenge.
2 days into quarantine, it was end of March when we realized this studio is not going to open as planned. And even more than that, mental health needs are going to skyrocket with all of this isolation and all of this fear of the virus. And so we need to put something up now, right? We need to build something now.
That sense of urgency propelled her team to launch a month-long free digital offering called Real to the People.
We have salons for sex and intimacy and managing being single in isolation, for juggling parenthood and working from home in quarantine. Really, the goal is to speak the language of people today and meet them where they're at and provide a therapy in a format they understand. Otherwise, they won't even engage in mental health care.
But within several weeks, the nation faced another crisis, the death of George Floyd that sparked demands for justice.
This is actually just after decades of police brutality and injustice to the Black community that there's an enormous need for mental health to be addressed.
In response, Chief Medical Officer Dr. Nina Vasan says Real is offering free group therapy for Black women, in addition to separate sessions for allies.
So a lot of times people feel very lonely and isolated in these experiences. And so being able to actually have a group where everyone has collectively experienced that same sort of trauma and grief ends up being incredibly therapeutic.
It's all part of Real's mission to break down barriers in the current mental health care system.
One of the biggest problems with mental health care today is that people don't access it until they've reached crisis. And we haven't built an ecosystem in mental health care like we have for bodily care.
With a subscription model costing $30 a month, Real members will have access to therapist-led events and an annual mental health checkup.
Right, it sounds like you two have been in such a rhythm.
Along with one-on-one or group therapy sessions for additional fees.
Real is really a paradigm shift from therapy today. We don't operate like a therapy clinic. Instead, we operate as a community-driven membership model. We need to instill this notion that taking care of your mental health is an everyday experience, even when you're not engaged with one-on-one therapy, right? One-on-one therapy is a layer on top of that.
Safira says what she has learned in this pandemic era will undoubtedly impact the future of Real once its physical location opens its doors later this year.
The real end game is to ensure that mental health care becomes a part of our everyday, our self-care, our healthcare routine, and for it to be just as celebrated as your annual physical, as your gym membership. Really, we're building that world, and we'll see the mechanism it takes to get there.
In 60 years, we went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You were donating plasma to get by.
It's literally a slave wage. I don't remember growing up like this. My mom didn't have to go to food banks. It's pretty sad.
How do we put this in perspective about how worried we should be?
We're going to share the newest numbers and critical information on the outbreak.
Vladimir Duthier is tracking the plight of the restaurant business. Vlad?
You've been talking to doctors. What are they saying to you about their experiences?
Doctors and scientists in a race against time to cure coronavirus. Every evening we'll show how close they are, racing to a cure on the CBS Evening News with Norah O'Donnell.
These are hard, tiring, taxing jobs, even before coronavirus came.
This is my Clorox wipes, my Lysol. I have no idea what I'm walking into. I don't know if the customers are carriers.
I feel privileged to be out here when so many people are out of work.
Did you ever think that you would find yourselves at the front line?
We have the opportunity to bring something valuable to the community, and that feels good.
We have to be willing to change policy on a permanent basis to recognize and honor these workers.
Doesn't seem like it's worth the risk that you endure every day.
I have to do what I can to take care of myself and my family.
If you had the choice, would you stay home?
Maybe, yeah.
The truck is sinking.
Devastating flooding has reached catastrophic levels.
Rising sea levels are threatening America's coasts.
You would have to take that house and put it on stilts 10 feet tall. If the street is filled with salt water, what difference does it make how high you make your house?
The concentration of the highest rental rates is exactly where the elevation is highest.
This was the evidence to prove that climate gentrification was real.
Pay $1,800 in 5 days or you have to leave. Were you scared?
Yes.
Every single person who stood up and said, I am not paying this rent increase, received an eviction.
Haitians built this place and you're getting kicked out.
Yes.
You can watch CBSN 24/7.
We've got an amazing story to share with you.
I understand you have some breaking news.
How does it all play out?
It's quite an adventure here at CBSN.
It's been a day.
Hello, everyone. I'm Tanya Rivero. Thank you for being with us. We begin with proposals by Republicans to tackle police reform. Today, the Senate majority unveiled a plan it hopes to pass as early as next week. The proposal comes from South Carolina's Tim Scott, the chamber's only Black Republican. It would discourage tactics such as no-knock warrants and chokeholds by withholding federal funds from police departments that allow them. Unlike the plan from House Democrats, however, it does not ban those maneuvers. Senator Scott's bill also makes lynching a federal hate crime and encourages de-escalation training. He says the bill is about restoring trust between police and people of color.
Too often we're having a discussion in this nation about, are you supporting the law enforcement community or are you supporting communities of color? This is a false binary choice. The answer to the question of which side do you support, it's I support America. And if you support America, you support restoring the confidence that communities of color have in institutions of authority. If you support America, that means you know that the overwhelming number of officers in this nation want to do their job, go home to their family. It is not a binary choice. This legislation encompasses that spirit.
Scott's bill comes a day after President Trump issued an executive order on police reform. The order encourages better training and tracking for use of force complaints. As CBS News White House correspondent Paula Reed explains, it's unclear what the president's move can actually change.
Without police, there is chaos. Without law, there is anarchy. And without safety, there is catastrophe.
Surrounded by law enforcement officials, President Trump signed an executive order that encourages police to implement best practices, like improving training, tracking excessive force complaints, and banning chokeholds, except where an officer's life is at risk. But it's not legally binding.
Americans want law and order. They demand law and order. They may not say it. They may not be talking about it, but that's what they want.
For more than 20 days, Americans have taken to the streets demanding police reform. But the executive order does not make any direct mention of racial bias or how to fix it.
Thank you.
Attorney Lee Merritt, who represents families of victims and met with the president at the White House just before the ceremony, said the order wasn't enough.
I have to say it fell kind of flat. There was nothing in the executive order that my office or these families could jump at.
The president blamed the previous administration for inaction.
President Obama and Vice President Biden never even tried to fix this during their 8-year period.
But the Obama administration did implement reforms, including banning the sale of some military equipment to police and opening over 24 federal investigations into law enforcement offices across the country. The Trump administration rolled much of that back. At a Senate Judiciary Committee hearing, Democrats blasted the order.
There is nothing about what the president announced today that would hold police officers who break the rules and break the law accountable.
Despite several legal measures being proposed in Washington, there is still growing urgency for fundamental police reform nationwide. In fact, some of the country's biggest cities have already made sweeping changes to their police forces. Let's bring in Ed Chung now. He is the Vice President of Criminal Justice Reform at the Center for American Progress. Hi, Ed. Welcome. Great to have you with us. You have a plethora of experience working on police reform. During your tenure at the Justice Department, you worked closely with the Obama administration and helped create a national initiative for building trust between the justice system and the communities that system serves. So how do you believe we now repair the broken relationship between communities of color and police?
Thanks for having me. And I think one of the big things to emphasize here is what Senator Harris talked about, which is accountability. When you see that law enforcement officers aren't held accountable, but not only officers, departments aren't held accountable for the systemic change that they have failed to implement, then that lowers the trust that the community has in law enforcement and in the systems of justice. So when we're talking about either the Trump executive order or Senator Scott's bill that is devoid of meaningful reforms and meaningful accountability, that's where it falls flat. You need to have accountability from our systems of government, and often police departments are the face of government to a lot of communities. So without accountability, there really is no police reform.
And Ed, as you know, there are many people across the country right now calling for defunding of police departments. You actually led an interagency effort to reduce the use of military equipment by law enforcement, which I know is a slightly separate issue. But I'm curious what your take is on defunding the police. Do you believe that is the best option going forward?
Well, whenever you talk about defunding the police, you have to first talk about where government has already defunded things, especially in Black and brown communities. You have to start with talking about where the government has defunded education or defunded social services. All of these other things that were conscious decisions, often in the name of fiscal austerity. And so when there is a hole in communities that government has already defunded, the one place that hasn't been defunded is policing, and police will take up that vacuum. So instead of talking about defunding the police, I think one of the things that we have to consider is where have we as a society, where have we as communities divested from, and where have we invested in? And in too many places, we've only invested in law enforcement as a solution, and that can't happen.
So you're saying the money comes from one pot and it has to be divvied up from that one pot, and we need to rethink the way we're divvying it up. Is that correct?
Well, in a lot of, if you especially look at state and local governments, it's different than in the federal government. State and local governments, there's a
right. That's
set
what I'm talking
budget.
about. The local level. They have limited funds, correct?
Right, and so you have to look at, first of all, how much of the policing budget takes up a city's budget. And it differs in different cities and in different localities, but especially if you are not funding these other areas, but also keeping funding levels for police at very high levels, you really have to take a look at that and see where your priorities are as a city.
Now, Ed, President Trump signed an executive order Tuesday to address excessive force used by police departments. And among other things, this order creates a database to track officers with excessive force complaints. You know, was it a wise move for the president to include that provision? And do you believe the executive order as a whole is a good step toward progress?
Well, I think both the executive order and, unfortunately, Senator Scott's bill is from the same cloth. It says a lot of good things and addresses or it tries to address things in issue areas, but it doesn't do so in a meaningful way. Again, both Senator Scott's bill and the executive order do not have any meaningful accountability measures in there at all. And you'll see that through their talking points as well. You'll see statements like incentivize or encourage or best practices or trainings, but you won't see something like hold officers accountable. And that's what you do see in
So, Ed, you have said reforming the police requires systemic change, which you say begins with holding officers and departments accountable for their failures, misconduct, violations of law. If you were directly advising the president or lawmakers on Capitol Hill, how would you suggest we do that going forward? In other words, how would you suggest that executive order we just discussed, Senator Scott's bill we just discussed, to give it some teeth? How do you give it teeth?
Well, the first thing that the administration do is you don't need an executive order to do. The Department of Justice under former Attorney General Sessions and current Attorney General Barr refused to take up their statutory authority and duty to investigate police departments for patterns and practices of misconduct and unconstitutional policing. You don't need an executive authority to do that. There is already a statute to do that. Yet this current Department of Justice has failed to push that forward. So increasing those types of activities are things that the administration can already do, as well as other things that are proposed in the Justice and Policing Act that is being considered by the House. So really, this Department of Justice has not only rolled back, as you said earlier, a lot of the reforms that were instituted in the previous administration, but then even took that a step further, and they were abdicating their statutory responsibility to investigate police departments.
All right. Well, Ed Chung from the Center for American Progress, we really appreciate you being with us. Thanks so much for your time.
Appreciate it. Thanks so much.
And we're going to take you now to officials in Tulsa, Oklahoma, who are giving a press conference. Let's listen in.
Had issues with scammers. If you get a call from anybody saying they're from the Tulsa Health Department, they will never ask you for money or your Social Security number. We are continually assessing capacity needs and have the ability to scale up by reassigning staff and utilizing the Oklahoma Medical Reserve Corps to meet the need for Tulsa County. My team, and I really want to be frank and honest here, has been working themselves to the bone on this response since it started in February. They're incredibly dedicated, motivated public health professionals who have been putting in long hours every day, 7 days a week, nonstop for months now. They do it because they care about our community. They are residents of this community too, and like us, we want to keep everyone in Tulsa and Tulsa County safe and healthy. There are a number of events and large gatherings planned in our community this weekend. We want to keep Tulsa County residents and visitors safe. I had the same concerns as the CDC regarding large in-person gatherings, where it's difficult for people and individuals to remain spaced at least 6 feet apart, and attendees travel from outside the local area are the highest risk for transmission. Let me be clear. Anyone planning to attend a large-scale gathering will face an increased risk of becoming infected with COVID-19. Also, I want to be clear. We support everyone's American rights as Americans to assemble. We want to keep people safe. So if you are coming, here's what we ask that you do. If you're part of a vulnerable population, which includes those 5 years old or older or who are immune compromised, please stay home. Seek other ways to participate virtually. If you are sick or have recently been exposed to someone with COVID-19, stay home and seek out virtual ways to participate. If you attend, Wear a cloth face mask covering correctly. The whole point of wearing this mask is to protect those around you. In case you are infected and don't know it, which is our biggest concern with asymptomatic spreaders, your mask should cover your nose and mouth, fit snugly against the sides of your face, and allow you to breathe easily. Avoid touching your face. The average human being touches their face 30 times every hour. Wash your hands with soap and water often. If those facilities aren't accessible, use hand sanitizer containing at least 60% alcohol. Be kind to those who are taking your temperature if that's offered at any gathering, or check your temperature beforehand. If you have a fever of 100.4 degrees or higher, seek out options to participate virtually. If you attend a large gathering, you should also monitor yourself for symptoms for 14 days and contact your healthcare provider if symptoms develop. Wear a mask to protect others in case you've been infected. People with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. These symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea. We have collaborated very closely with community partners to keep our community safe. St. Francis Health System, one of our local hospitals, has generously donated 40,000 masks to help in the fight to lessen the spread of COVID-19 in our community. Now that healthcare systems have had a chance to secure PPE for internal populations, including staff, patient, and visitors, they have also been able to secure masks from a supply that is separate from what they use for staff. Beginning Friday, anyone can visit Reesers, Rib Crib, or Catholic Charity locations to receive a free mask while supplies last. This is a great example of public-private partnerships working together to keep our community safe. We've had a lot of questions around where people can get tested in Tulsa County. There's many opportunities to be tested for COVID-19 in Tulsa County. Our local hospitals and healthcare systems offer testing to their patients. The OU Tulsa and OSU Center for Health Sciences also offer testing. There are several Walmart and CVS locations that offer testing. Of course, the Tulsa Health Department does as well. Our agency has increased testing several weeks ago, and we have received information on testing sites in Tulsa. We have information on our testing sites in Tulsa County on our website. I encourage everyone seeking tests to visit our website for a list of those resources. As a public health agency, our job is to provide the guidance and recommendations to keep our community safe. Tulsa County has done a tremendous job over the past several months to slow the spread and allow our hospitals time to prepare. Stay the course. And as I said before, I know so many people are over COVID, but COVID is not over. COVID is here. It's transmitting very efficiently in our community. Please stay the course, follow recommendations. If you're in public, wear masks, social distance, pay close attention to hand washing and hygiene, and keep yourself safe and healthy. At this time, I would like to introduce Mayor Bynum.
Thank you, Dr. Dart, and never miss an opportunity at one of these to say how much I appreciate Dr. Dart and his team, the great work that they do in our community. I think it is very important, we haven't had one of these in a while, I think it's really important to talk for a moment about where we are right now versus where we were in mid-March. We faced a situation there in early March where we had a new virus that had arrived in our community to which no one was immune. We were, just by luck of geography, we had about a week and a half of seeing how cities on the coasts handled the arrival of that virus before it really started to spread in our community. Our hospital systems, when I talked with doctors and physicians there, what I heard from them was that they did not have the protocols and the equipment in place to handle a virus like coronavirus when there was an entire city that wasn't immune to it, and there was real concern about that virus overwhelming our local healthcare system. There was a point when we initiated restrictions as a community where one of our hospital systems was down to less than a week of protective equipment for their staff. We locally initiated drives for companies and individuals to donate protective equipment so that we could give it to our hospital workers, because there was such a concern locally that they would run out and not be able to serve those most in need. There was a real fear about running out of beds. There was a real fear about running out of ventilators. And with all of that concern in mind, we recognized that we had to do something in this community which, to my knowledge, we have never had to do before, except in isolated instances in very localized geography, which is put in place restrictions on gathering, on how many people can gather, and eventually escalating all the way to shelter in place for our city. And we maintained that for over a month as a city. It is important to remember, though, that we did that not thinking that we would prevent anyone from ever getting coronavirus. The purpose of that and the purpose of flattening the curve was to slow the spread of the virus so that our healthcare system could build up the capacity that they needed. And in that time that Tulsans were